I see questions flying by as I'm talking. Mari, is there anything you want me to field for questions that you're seeing?
I think there's a question about having the vaccine before or after chemo.
Again, my opinion, and I think Rance, as maybe the only other oncologist on the call today, would agree. The sooner the better on immunotherapy, and that is what we saw with the Listeria dogs. Some of them are my 3 to 4 year survivors. Are the dogs that got it at the time of their amputation or shortly thereafter, paired with their carboplatin chemotherapy. We can do it at the same time. I don't like to give it necessarily if their white cell count is a little low. But Washington State's giving it at the same time as their radiation for pain. So ultimately, if we can get it early on in the course of the disease, so the sooner the better.
And we have not yet published this, is that yes, dogs can receive chemotherapies at the same time as vaccination. There is a lot of data out there, largely in the human vaccine and chemotherapy arena, that indicate that carboplatin and doxorubicin, 2 of the most commonly used chemotherapies for pups, don't interfere tremendously with antibody or T cell responses. And this is true in studies in humans as well. And reiterating what Chelsea indicated, of course, is earlier the better, as one can imagine.
Can you predict which dogs are going to respond based on the blood tests?
That's a Mark question.
There are some questions about, do I know if my pup has responded at least with an antibody, a measurement of antibodies after vaccination? The answer to that is yes. We can measure antibodies. Well, we get blood samples before vaccination and after, and I can tell you from our experience that most all dogs respond to the vaccination. Very few do not get measurable antibody responses. It does happen, just as in human vaccinations. Not all human vaccines work in 100% of humans. But we can measure levels. We don't yet know what levels correlate with clinical outcomes. Again, a lot of the questions that relate to, will my dog get better or response, which we all want to know, we just can't predict that based on good antibody responses or intermediate antibody responses. I can tell you from experience that we've had a lot of very good clinical outcomes in dogs that have what would be a marginal or even low antibody response to the vaccine. Conversely, we've had dogs that have had a very good antibody response that have not done well. But this is what the clinical trial is designed to study, are the features of individual tumors in individual dogs, where the tumor may reside, whether there are metastases, other intangibles like the age of the dog, the gender, the breed. All of these things may make a difference. We just don't yet fully know with respect to our vaccine therapy.
We're going to have multiple cohorts that come out of this in terms of dogs that had standard of care carboplatin at the same time as vaccine, dogs that were not amputated and had radiation and vaccine, dogs that have maybe done oral strategies instead of carboplatin and had vaccine. So there's going to be layers of dogs that we're going to get to look at to be able to say, okay, this group, how many did we have in this group and did they all do well? And maybe we can start to ferret out that information of which way is the best way. Probably the only thing drawback wise we want to try to stay away from is immunosuppressives like steroids and Apoquil and Atopica and things that modulate T cell response, because we don't know that their response to the vaccine will be as strong in those situations. I have a couple kiddos ultimately have had to be on steroids. I have a little Boston that has osteosarcoma with pemphigus foliaceus as well. So I'm very interested to see how this dog does, because she has another disorder that requires her to be on steroids. So we are still looking at how to make the immune system respond the best way possible. So.
Can you say something about side effects that you're seeing and correlation of side effects, for example, lumps with the success?
Yes, absolutely happy to address that one. And we have studied this carefully. And these are from local patients here in Connecticut that have received our vaccine now several years ago. And some of them had passed away, and we had the opportunity to examine virtually every tissue out of dogs that received our vaccine. And in 5 or 6 or more now animals that we've examined, we don't see any bad side effects in other tissues. And we've looked at heart, liver, lung, brain, skin, kidney, etc. One side effect that I personally consider minor relative to all of the things that dogs go through, including things like amputation or other surgeries and chemotherapy, is inflammation at the site of at the injection site. From our experience, it only happens in about 20%, maybe 25% of the dogs that receive our vaccine. It can be anything from a small lump under the skin where the vaccine was applied, and that can be like a marble-sized lump. It can also get larger, even as large as a golf ball, and it may even leak a sticky fluid. The fluid is not tumor, it's not infection. The vaccine is perfectly sterile. What it is white blood cells, or certain classes of white blood cells, primarily neutrophils, that come to the site of the vaccine and start to nibble it, for lack of a more appropriate scientific term. And that's actually a good thing. That's what starts the immune process. But don't be discouraged if you don't get the lump, because immunity still can arise.
I'd like to ask a question just real quick, and that would be that I was wondering if any of the dogs that have shown metastatic cancer, like to the lung or anywhere else, have they been resolved? And I'm asking that question just because my dog had that cancer resolved within 3 months. I mean, he had a lung tumor, and with 1 month, it had stopped growing, and within 2 more months, it was gone. And I was wondering if either one of Dr. Tripp's or Dr. Salone's dogs, if any of you have had metastatic cancers gone to other organs, and if they've been resolved also.
I have a handful again of known metastasis. Our protocol is that they have to have chest filmed within 30 days of the vaccine to know where their status is on their lungs. And if they don't have that, then I take them a day of for their first vaccine. And I've had a couple that have traveled to us that unfortunately, when they came, they do have visible metastasis. Now, again, those are dogs we have to follow out, and we're barely kind of 3 to 4 months in here. So similar to Ranger, I expect we may know the answer to that by summertime on some of these kiddos. But yes, known metastasis is still a possibility. Ideally, we would try to catch them early on in the process with 1 or 2 small nodules versus kind of a whiteout effect happening in the lungs, or if they're clinical, because of the lag time that it takes for the immune system to take the signal. It's a race between what the cancer is trying to do and what we can get the immune system to start to recognize. So the sooner the better.
Is there a wait list for OSA dogs to get the vaccine in Washington State?
Is that
At Wazoo or with us?
Either of you, both of you.
No, we've gotten through the wait list, and they call, we get them scheduled.
and people calling us are at the mercy of our appointment schedule. Again, as one of the few radiation therapy facilities in the Pacific Northwest, there are limits to how many patients we can see and treat. And we see radiation therapy patients in addition to our medical oncology caseload. And so there can be a bit of a wait, That said, our schedulers do try to put a priority on the osteosarcoma dogs because of their pain and discomfort. In most cases, if we get a call from a veterinarian that says they have an osteosarcoma dog that an owner's interested in palliative radiation therapy and they want to come see us, we try to get those patients in whenever possible within a week of the call.
And
Great.
Mark, I'm going to ask you, because this is a question that every one of these people that are on this line right now, is there a chance that this therapy will open up at other facilities closer to home for many of them?
You always get right to the important part of what we're doing, Rick. I've always appreciated you for that. Yes, we do have other clinics on board that are willing to be a part of this clinical trial. And ultimately, I hope part of the therapy as it evolves in the future as well. I'm trying to collect all of the sites to submit to the USDA at once for approval, as opposed to one clinic at a time. And again, it's mostly out of pure guilt that I experience at night of people having to drive long distances to the state of Washington. So we're trying to set up sites around the country. We will have one in your neighborhood, Rick, in Ohio, one
Great.
outside Cincinnati.
Oh, great.
Potentially one in Chicago, Virginia, Dallas, so I believe Michigan. And I'm looking for sites farther on the East Coast, New England at the moment. I can't yet tell you when those sites will go live. There are criteria for this clinical trial. We want to get all of the data that we're discussing to answer all of these complicated questions. So it's not simply how quick can I get it to your vet. It's, can your vet provide the follow-up analysis, x-rays, follow-up appointments, etc., blood samples, all of those things which we're interested in control. You know, again, I'm trying to reduce my interaction and paperwork with the USDA by submitting multiple sites all at the same time. I will tell you, I guess, there's a chain of veterinary clinics that we're trying to get on board. The bureaucracy there is a little bit more difficult than individual institutions, but there is an economy of scale there in being approved for all of their sites. So that's in part what I'm waiting on in approving new sites for clinical trials. We hope to be there as well. I have negotiated import agreements with the Canadian Department of Veterinary Biologics that allowed us to be there in the past. We don't yet have trial sites immediately in Canada.
For owners that live in British Columbia, potentially Saskatchewan, we are accessible. Dr. Tripp's practice is accessible to Vancouver, for example. There's a big population center there in British Columbia, and she is closer to them than WSU is. But we actually had a patient that had come to us for the vaccine from a community in British Columbia. So yes, we can take patients from Canada, but obviously they have to come to WSU or they'd have to travel to Edmonds and Dr. Tripp's practice.
How about cats? Do you think?
Oh, cats.
I'm sorry.
No, unfortunately not in cats for a number of complex biological differences between cats, dogs, and humans. So at the moment, we're taking baby steps into getting the data in dogs.
I have a question. When you get a patient with a lung metastasis, do you also prescribe a propranolol, losartan, dasatinib combination that CSU and Tufts have been looking at?
It depends on if the client's our client or traveled to us.
Mhm.
We are being very respectful of what other oncologists are recommending for those patients and are really playing the role to serve, to get the vaccine and send them back to their oncologist. So it's very reasonable for them to ask those questions of their oncologist. I can say that I have prescribed that for some of my own patients here, but I'm not having a conversation about changes in their overall plan, just more to get the vaccine as part of their care.
Got it.
And ditto for what Chelsea said for us. Yes, we have done various things for dogs with proven metastatic disease, including dasatinib, losartan, other chemotherapy approaches. If something doesn't work, we'll try something else. But for dogs that are under the care of another oncologist, we defer to the protocol and the plan that the oncologist has put in place.
I'll briefly address the cancers that are not appropriate for our particular therapy. And those are the so-called liquid tumors that include lymphomas and leukemias. And then the other tumor types that we've talked about, I won't reiterate, but we've selected based on the known expression of this family of proteins called EGFR HER2, either in veterinary practice, veterinary patients, or in human patients when they haven't been necessarily or carefully studied in dogs.
Mark, also, could you share some of your data, early data for hemangiosarcoma?
This is literally being written up as we speak with Dr. Hester Doyle in our group that is really the important person behind all of this work. She analyzes all of the serum samples, does all of the careful molecular studies that we do, tissue pathology, immunohistochemistry, all of that. So all of that is in her lab. I try and stay out of her way, honestly. I can generically say that the outcomes in hemangiosarcoma, similar to osteo, appear to be statistically significantly better than standard of care. Hemangiosarcoma, I'm sure, as the practicing veterinary oncologist here will admit, is a very difficult, a very aggressive disease that is very dependent on individual dogs. I can tell you frequently, unfortunately, a lot of people contact us or get involved in the program far too late in the game. With that said, I think there was also another question whether this would be a, quote, healthy dog vaccination to prevent tumors in the future. The answer is no, not yet. We do know that the immune response to this vaccine starts to subside, starts to get lower after about 12 or 14 months, frequently requiring an additional third vaccination, similar to the COVID vaccine, where a similar outcome is observed, where antibody responses start to decrease after 8 to 12 to 14 months. Such is the same, as it appears, with our vaccination strategy. Do you ever see dogs resolve metastases with chemotherapies? And if you do, how frequently?
That's an unusual scenario, I would say, where we actually do get the benefit of seeing resolution of visible metastasis. And ultimately, I've thrown a number of drugs at lung metastasis for osteosarcoma, and I've probably maybe only stabilized things to a certain degree in patients over the years. So to actually get a visible resolution of metastasis is not something I've experienced with non-traditional or traditional drugs in my clinical practice.
I don't have an experience different from Dr. Tripp's, and collectively, I can't think of situations where my colleagues have seen reduction, certainly not disappearance of existing metastatic lesions in response to, I'm going to call them conventional medical therapies, which could encompass things like chemotherapy drugs or other non-radiation, non-surgical approaches. I generally tell clients that if a dog has visible metastasis and we can keep their disease stable, that's a victory for this tumor and that clinical status.
So Professor Sellen, Mark and Chelsea are now starting in collaboration with Oregon State University. They're collecting extra blood sample and fecal swipe samples to look for biomarkers in microbiome and in blood to be able to correlate and predict who's going to be responders and non-responders. Is that something that you might be able to participate in? I understand you probably have to change your IACA, but is that something you might be interested in participating in?
If we had the appropriate indications and knew what the protocols were, what the samples were,
Okay.
best I can say is that we would entertain that possibility.
Okay, great. Thank you. Well,
Mark, I put a link for the paper that you've published on this, but I think, again, everybody is on this Zoom meeting to hear for hope. And those 500 dogs that have been participants in this study prior to the two in state of Washington, can you give them a brief idea about the results so far as to the outcomes? Again, a few dogs I know had lung mets resolved, but many, many more have lived beyond the year, 6 to 8 months or whatever with the vaccine. Can you give anybody any hope as to those results?
I'm happy to discuss what we've published and even what we've not published. So a weakness of our past studies is in not having had regular radiographs, x-rays taken among our patient populations. Those things were difficult to control among the original group of participating veterinary offices. However, we did get regular x-rays done by enthusiastic and thoughtful families for their own pets. And what I did report was 3 cases in the original study and an additional 3 cases that we have not yet published of carefully done regular radiographs that indicated either static lesions that don't change in size, and that was in 1 of the 6 cases, and the other 5 cases found either partial or full regression. Now, I'm very careful to interpret these in that, the interpretations are from different radiologists, et cetera. I don't interpret any of these on my own. These are from board certified radiologists. But having said that, it's certainly a topic we're very interested in, and/or I'd personally be interested in having participating clinics recruit those patients because, of course, and I think Dr. Sellen will agree, that's the main source of morbidity and mortality in osteosarcoma.